Good evening. This is the November 2024 meeting of the Community Service Committee of the Common Council for the City of Norwalk. We will call the meeting to order at 7 o'clock on the dot. Myself, Nicole Ayers, is the chairperson. I have with me Councilperson Dunn, Councilperson Warner Strand. Sorry if I messed that up, and Councilperson Smith, Councilperson Sutton, Person Burnett, and Chief of Community Service, Lamont Daniels. Is there anybody online for public comment? If you are online for public comment, please raise your hand. You will have to state your name and your address, and you have 3 minutes to speak. We ask that you only speak on items that are on the agenda. Is there anybody here for public comment?
Madam Chair, we do not see anyone tonight for public comment.
Thank you. So we will close public comment at this time. Continuing on with our meeting, we will have the approval of the minutes from the October 16th meeting. Can I have a motion? Mr. Burnett. Are there any corrections? I have one correction. My name is spelled Nicol, no E, please. And my last name is Ayers. There's no apostrophe in my name. And it's misspelled throughout. So whoever is taking the notes, if they could correct that. Thank you. All in favor of the approval of the minutes from October 16th, raise your hand. Any of those opposed or abstentions?
I have to
It is
abstain.
Yes, it is passed with 5 council persons, and Ann is abstaining as she was not present at that meeting. Okay, we are now going to have our presentation. I see the very talented and capable Mary Oster here to talk to us about early childhood. It's all yours, Mary.
Oh, thank you so much. Okay, thank you, everybody. Good evening. Really appreciate being here, and thank you, Chairperson Ayers, for asking me to be here. I'm going to share my screen. Everybody can hear me okay? Yay, okay. And I'm going to share. Okay. Okay, can you all see that okay? Okay, I'm just going to share a real short presentation, and I can't really see everyone, so if you have a question and just feel free to jump in, and because I can't see you all. So okay, so a little bit about early care and education in Norwalk. According to the most recent census, we have 6,791 children ages 0 to 4. That doesn't include our 5-year-olds. And in early childhood, early childhood is really defined as ages 0 to 8. So it doesn't fully reflect all of our kids, but I think it gives us a good starting point anyway. Here in Norwalk, we have a really robust array of early care and education programs. We try not to use the word daycare because it's all education, right? It's all brain building from in utero, but we're all working on building brains, building children's brains, because we know that from 0 to 3, their brains are growing the fastest. And so we want to really make sure that we give kids a good start. We have center-based and family child care, and these are all their own small businesses. So center-based, we have 31 small independent businesses, all licensed by the Department of the Office of Early Childhood, the OEC. 11 of those centers receive state funding, and that means they receive a stipend per child through a contract with the state, and tuition is on a sliding fee scale. Of those, in those programs, collectively are 79 infant toddler slots and 700 preschool slots. And certainly The need for infant toddler is very high. We'll touch on that later. And so we are full. Those subsidized slots are always full and have a wait list. And we are always trying to get more infant toddler slots. Head Start is in 2 locations at Ben Franklin and Nathaniel Ely. It is run by CIFIC, which is an organization in Danbury that also it's like their CAP agency in Danbury. And they have the Head Start contract here in Norwalk. Of those 140 slots, 16 are toddler slots. And again, those are always full, as are all of their spots. And then we have the Norwalk Early Childhood Center that's at 11 Allen Road next to the Senior Center that's run by Norwalk Public Schools. And that is for children with IEPs. And then they also have typical peers with the children. And then family childcare, we have 51 family childcare homes in Norwalk. They again are all licensed by the Office of Early Childhood, and they can take up to 6 children. And here in Norwalk, as well as probably throughout the whole country, they do provide the majority of our infant toddler care. Family child care tends to be a little bit less expensive for families and a little bit more flexible. So if we have families that need evening care or really early morning care, often they would access family child care. Any questions? Okay. All right, so what are some challenges? I am sure that you have heard, and certainly if you've talked to me, you've heard that staffing is our greatest challenge. We cannot afford to pay our childcare staff what they should be paid. Many of them have associate's and bachelor's degrees, and they are earning far less than their public school counterparts. The average salary for childcare workers in Connecticut is about $17 an hour. We're a little higher than a lot of states because we have a higher minimum wage, $15.69 an hour. Childcare workers are paid slightly less than dog walkers. And we know childcare is really hard work. Those of you that have raised children probably know that as best as anyone. It's hard physical work, and it's very hard. It's hard mentally. Kids come with a lot of stuff, a lot of curiosity, a lot of emotions, and it's really hard to maintain that staff. I would say here in Norwalk, we do such a good job. And anytime we hear of someone that is looking for a position, sometimes the Open Doors Career Center will call me, or the Resource Hub at City Hall will call me, and we will find a place for them because we always have programs that are in need of good staff. And of course, they all have fingerprints and background checks. Unfortunately, they don't often have a lot of experience. And so that means it's really hard to retain them. Our programs do the best they can with training them. We have done a lot of work with the Odyssey Family Executive Center, getting folks into an entry-level training program. It's the CDA, Child Development Associate, so that at least that gives them a base and gives them the tools to be able to work with kids. And then that helps them stay a little bit. So that's really something we try and focus on is really the longevity, getting people to stay, because kids need that they just can't do a revolving door of staff. And so it's really, really important that we try and keep as much staff, train them well, and hopefully pay them as best we can. Programs cannot raise tuition. Anybody here who has had a child in a childcare program or preschool knows it's very expensive. And so it's really hard to pay staff what they need to be paid. Many of our staff are accessing other services like SNAP, Medicaid, and other services because subsidized housing, because they can't afford it. It's expensive to live here. Childcare is expensive for families, and that means a lot of families either work, parents either work multiple jobs or they choose to stay home. And we know that collectively that reduces our productivity in the workplace. Or they might choose maybe a less than ideal situation. Sometimes grandma and grandpa are a really good option, and sometimes they're not. And so we have kids that maybe are not in the best place for them to be. It's also hard for programs to meet the needs of families. Sometimes the hour of operation does not work. They often would then access family childcare that may have longer hours, evening hours. We have families that don't have transportation. They don't have a car. And so it's really hard to get from place to place using our bus system. Although the Wheels to, or is it called Wheels to You? I think that's the name of the small bus that you can call. That has really helped a lot of families. And then we have families that have a lot of needs too. Parents are stressed. You hear it in the news all the time. And so they really rely on the child care program to be that kind of that anchor. And our child care programs are really great at helping families themselves to access services like we have at Norwalk City Hall with the Resource Hub, different things like SNAP, Medicare or Medicaid, Husky, that kind of thing. And then a little bit about what we're doing here in Norwalk to support young families. We have a number of literacy initiatives. You may have seen those little library boxes around. I have one volunteer who helps maintain. We have 2 boxes freestanding and 2 in laundromats, because we know kids are in laundromats, and we run about 4,000 books through those four boxes a year. The town clerk has our little new baby book bags that has a new book in it. The little libraries are all like gently used books, but we give new books in a little bag with information. The town clerk gives those to anybody who is coming in for a birth certificate, and we do about 400 of those a year. We have a volunteer reader program where we have volunteers who are trained by the library. They go into classrooms and they're there every week, and they're really there to provide just additional exposure to really structured, robust read aloud. We know that helps children's literacy and language development, especially our kiddos that are not English speakers. And we have a lot of those. So it really helps for them to have that additional exposure. Read to Grow at Norwalk Hospital. Oh my gosh, what a wonderful program. That is being funded by the Hospital Foundation. Every baby born in Norwalk Hospital gets a new book. The parents can opt in to get 2 more books, and they get some information in the mail. And that has been just a wonderful program. And so that's about 3,000 books kind of in the system. And then Waterford Upstart is a really great literacy program for our rising kindergartners. It's free of charge to families. They provide a device, a little computer, and also a coach who calls the family and really helps them. The kids do about 15 minutes a day of the language and literacy development, and it kind of grows with them. So depending where they started, kids can start at all different kind of places. And we have about 200 children enrolled, and those are children who would be going to kindergarten next September. We do a number of events out of this office, including our Celebrate Early Childhood event that's held at the Sono Collection. This year we had, it's held in the spring. We had about 400 people attend that. We have movie nights at City Hall and the Fall Festival on the Green that we just held in October. And those are all done with our community partners. My colleague Carol and I, who is the school readiness liaison, have done some presentations recently. We have a really great, we think it's a great presentation about bringing play into the home. A lot of families don't know how important play is. And so we're just there to provide resources and talk about how our family childcare and our center-based childcare can really encourage families to bring play into their home, and what they can do, what low cost, different There's some apps that are really great with ideas that parents can do at home. And we presented at our state conference for the Association of Education of Young Children, and also an All Our Kin regional conference that was held in the Bronx last weekend. And we have a number of different partnership activities. We have a wonderful group of early childhood advocates from Norwalk ACTS, and they are amazing they're all over the place. They're especially at the Norwalk Community Health Center, really connecting with families, making sure families know what services are available to them, getting them to complete the ASQ questionnaire. The ASQ is a developmental screener that can start at 2 months old. And that really helps them understand where their child is developmentally, and perhaps what they can do to help their child develop on track. And then if not, what services they could access to help their child. I'm also working with Norwalk Public Schools. We have 3 student interns that are in our early childhood programs every year. So I work very closely with Carol Wiltshire Toth from Norwalk Public Schools. And then on the state level, we do a lot of advocacy work. We're talking to our state legislators all the time. We're very fortunate that we have a wonderful legislative delegation who's really supportive of early childhood. I'm the state co-chair of our professional organization, the Connecticut Early Childhood Alliance. And we have legislative forums and other legislative events. And the other thing that we just have started, and which is really exciting, we've been talking to the community college, Norwalk Public Schools, and myself about workforce pipeline through the high school. Part of our problem is we don't have people going into the field. Guess what? Because it's a low wage field. But as we're trying to get money into the system to hopefully boost wages, we need to have people in that pipeline. And so we are working on a plan, because the Office of Early Childhood at the state level is looking to have something to pilot, and we're hoping that they will pick us to be a pilot project that they will fund, and we'll be able to do something a little bit like P-TECH at Norwalk High, but without the IBM money in it. So we're really excited about that opportunity. And so I am going to stop sharing. And I don't know if anybody has any questions, or I know that's a lot of information, but be happy to answer anything.
Hands. All I see is hands. I saw Councilperson Smith first.
Thank
Hi
you,
there.
Madam Chair. Hi, Mary. Thank you so much for that presentation. And more importantly, for your passion and commitment to our kids. You're a force. You really are. And
I have so much fun. It's great.
kids are great.
Yeah, it's great.
I have 2 questions. First, and I think this is a little bit simpler, is with the zoning, there's the recent zoning change to allow more flexibility around the childcare. You were involved in that, right? You spoke to zoning. So I'd just kind of like to hear your perspective on, how's it going? Are you starting to see some interest in that field growing? Is it making it easier?
Well, okay, so yeah, I mean, certainly any way we can streamline for these small businesses, it's great. So out of the 51 family childcare, we have 2 group homes, and for someone, so a family childcare is one person, usually a woman, in her home, dedicating a room, getting it licensed for six children. A group home, which is like the next step, and there are 2 of them in Norwalk, one on I think Betswood is the one, that's Myra, who Baby Beluga, she is the one that wants to become a center. to go from a family childcare to a group home is a huge lift.
Mhm.
There's a reason we only have 2 here in Norwalk, because it is the jump from family to group and then to center. It's like from here to here, and then this, so you're almost at a center based if you're a group home. So it is a lot. They have to have fire abatement. They have to, I mean, like, I can't tell you. So for people to want to do that, they have to have the money, the education. I mean, it's such a big lift. So I would not, because we only have 2 group homes, I would not anticipate that we would have more than a couple, 3 group homes wanting to go that extra step. I mean, you rarely have somebody going from family childcare to a center at the same location. Because it's just a huge lift. I mean, we do have a Watch Me Grow is a program over here at St. Paul's Church. It's a center-based program. And the owner has a family childcare in Stamford. And then she opened up this center base, but see, it's two different locations. So I don't anticipate that we would have that. I think Myra is in a interesting situation where she is, because she's really got she's got a pretty big walkout home with a big driveway, a really wide driveway, so it could accommodate some car. I mean, so she's in kind of a good place if she could get that exemption to be a center-based program, because she wouldn't have that she's already a group home. That is not that big of a jump to be a center.
And so those recent zoning changes will allow for that type of thing to happen.
Yeah. Yeah.
Okay.
And she actually has infants and toddlers. She likes to, once they hit a certain age, she likes to get the parents connected to a preschool, because she loves those babies. And so that's a really great place for babies to be.
And then my other question really is more about, I knew that the pay was very poor, but to hear that dog walkers make more than childcare providers is really,
Yeah.
really, really unbelievable. And I know, how much you advocate at the state level. What are you seeing some, ideas and real work around how we can improve that situation? It's not a problem just here. It's throughout the whole country. It's like,
Yeah.
we don't value, as a country, we don't value taking care of kids. It's shameful, really.
Yeah. Yeah.
So, what's being talked about? Are you able to share anything that's,
Well, I mean, we're always trying to get more money into the system, because that's what it's going to take. There is kind of a plan afoot, and I really can't say too much about it. I mean, an early childhood fund was developed or was started to be able to take, because that's what it's going to take, is like a dedicated pot of money. And a lot of states are doing it creatively. It's either, I hate to say this, it's like a tax, or in New Mexico, they have, mining and stuff. And so there's somehow that, a bit of that is going into an early childhood fund. So that's really the only way that it probably will work, is that if we have a dedicated fund, which in Connecticut we do, but we don't have any money in it because they didn't put any money in it, but at least it's there. But, with everybody, you all know that we have the fiscal restraints on our budget, and, whether the state the state has a lot of, I just lost the word, excess money, floating around, but there's the guardrails. And then are they going to allocate some of that money to early childhood? I mean, we've been advocating this for years and years, but I mean, as a country, we're not, as you said, we're not valuing it. And really, early care and education should be valued like the infrastructure that it is and like K-12 education is, it's.
Yeah.
But you don't want me to get on that soapbox.
No, I know. And we also have a friend up there in the
Oh, my
Director of
gosh.
Early Childhood, Eloisa Melendez, our
Yep.
council member and DTC chair. So she has a lot of passion for
Yeah.
early childhood care as well. So
Yeah. And our delegation is terrific. So
Terrific.
very, very supportive.
thank you, Mary.
Okay, I just want to acknowledge, I believe I saw Councilperson Wiggins join us at 7:18, so just want to acknowledge him for attendance
I've
purposes.
been in like 7:05. I'm sorry. I wanted to say something, but she was talking.
Okay, just give me a moment. It's someone before you. Just give me one moment. Councilperson Burnett?
Thank you, Madam Chair. Thank you, Mary, for the presentation. And I really appreciate the comment that you made about this is not babysitting. This is education. We're training, we're making the investment, we're training our young people to become further scholars. So my question is, aside from funding, we know that a lot of things can be solved, issues can be solved with additional funding, but what else can this committee do, the Common Council, the City of Norwalk, the Board of Education? What else can we do from your perspective to enhance the service that we provide to our young learners?
Well, just having me here shows that you're really interested. And I think the more people know what we're doing here in Norwalk, I mean, as I, meet with other people around the state, Norwalk they're always talking about what we're doing down here in Norwalk and the great infrastructure we have. I mean, we have just a wonderful coalition of childcare providers who really work together. And that's hard because it's kind of everybody's their own little business. So just having a little bit of structure through our office here is really, really helpful. And just, on the state level, advocating for increased funding, if it comes from other people and not just people like me, that's really important because we're kind of all in this together, right? I mean, it's even if you don't have children, we want a really well-educated kids. We know it's important. I mean, frankly, there are future doctors and teachers and people who are taking care of us as we get older. So just really, spreading the word. And you have been so generous when we've asked, council people to read. So, if you have time and can read to our kids, that's important because then they see you and you see what's going on. And then that is really helpful to have that exchange. And when our directors and teachers see people coming into their program, they feel, a little bit more valued too, because sometimes it's hard, it's hard work. And so just being acknowledged by other people who aren't the parents of the kids they're taking care of really goes a long way as well. So, but just supporting our department is really important. But, I really feel fortunate that we do have a lot of city support. The mayor is always very supportive and, I was very interested in what's going on. And so I appreciate your interest as well. I mean, that's really important.
And just quickly, a quick follow-up question. Do you have what I'll call a kind of an impact funding statement? And by that, I mean, that outlines if we had another $20,000, this would be the impact to the program. If we had another $100,000, this would be an impact to the program. Do you have anything like that you can share with us that would show that any additional funding would result in this type of impact to improve early childcare?
We have something more at the state level, but I can absolutely work on something at the local level. I have put some stuff together in the past. and it would definitely need to be updated. But yeah, I can absolutely come up with something.
And I think that would be timely to have as we're
Sure.
preparing the budget at this time.
Sure.
Thank you so much.
Absolutely.
Councilperson Wiggins, did you have a question?
No, I was just saying I came in at 7:05.
Okay, but nothing from Ms. Oster?
No.
Okay, thank you. Yes, Councilperson Dunn.
I had a question for Mary. Can you talk a little bit about what's going on as far as the health for these children? Immunization stuff, things that we may need broader throughout the city beyond the education, for the whole
Sure.
child.
Sure. Well, so all children have to have, an updated health form, and they have to be up to date in their immunizations. And actually here in Norwalk, we're about, I think, running around 90% of our kids being on track with the immunizations 0 to 3. So that's really important. We have some amazing people at the health department that do that. And so all our kids are required to have, they all have to have a flu shot. Any child in care has to have a flu shot. And I can't remember at what age, but definitely preschool, and it maybe is toddler, but I'm not real sure about that. So we have, all of our children are up to date in their vaccinations. There was no exemption anymore. So yeah, and we have not had any issues with that at all.
I guess my question wasn't so much the issues, but I
Oh.
know that you do provide some funding and the health department does support you. And I know it's a leading question because I'm kind of aware of a lot of it, but if you could just talk a little bit about how important that is. That
Oh
we
my gosh, yeah,
do health department for physicals, low
Yeah.
cost, it's not a barrier, immunization, low cost or free.
yeah,
Okay.
yeah. I mean, the Norwalk Community Health Center, wonderful partner. And the health department does come in and do different things with the kids as far as like a flu and you thing they do with sparkle dust or something, show them how to wash their hands and all that kind of stuff. So we have some great partnerships with the health department.
And Mary and Councilperson Dunn, if I could just jump in, because I just always like to clarify some things, specifically the health department has a role, but I just want to be clear, the health department doesn't lead the initiative. We really rely on our federally qualified health clinics. So I know sometimes in other communities and other jurisdictions, the health department takes an active role, their lead initiatives. I like to think of, we complement the vaccine program, we complement physicals, we complement, quite frankly, we just don't have the resources to lead with staffing and equipment, but most certainly under Deanna's leadership, our health department is on the front line. And then secondly, and this is, not to go in a deep dive, the Women and Children's program, it's a grant program through Optimist that is housed at the health department. So it gets kind of confusing because just because it's in the health department, people would say that's a health function, and the public doesn't need to know all that background administrative, but for the sake of, again, to your point of leading question, just want to be clear that we are at the table and work when we get the data, because as the public health department, we do know what our numbers are. We will try to support initiatives citywide to encourage, the different vaccinations and support, and looking at barriers, whether low cost. Ours is not free either, but definitely we're not paying what a physician would pay. But again, we have 2 federally qualified health clinics that really can do the waivers and all the various things. The health department doesn't bill in that way, is set up in that way. Something we could look at, but that's a totally different conversation. And I'm going to require you to give me money to make it happen if that's something we want to explore.
Well, that's kind of why I was asking, we're all, budget based to some degree too.
Mhm.
Where are the barriers, where are the needs? And you're saying that 90% of them are there, are there barriers that, funding would help, or grant writing? I know you do a great job with that.
Right. 1/3 of our health department is grant funded. So
Yeah, okay.
Oh, yeah.
So that last 10%, is there anything that we could do to help?
you can take that one.
Yeah. That, yeah, I mean, I don't know. That would be a question definitely from for the health department and the folks who are in that piece of it. I don't know. It could be that they're just people who are transitioning in and out of Norwalk. We know we have people moving in and out every day. So I don't know if that would account for that or not, but we are definitely the highest in the state.
My
Yeah, we were
last
high
question,
with our
sorry.
COVID vaccinations as well.
Yeah.
Compared to our neighboring towns and community.
Yeah.
And how about, feeding food, healthy food is so important too. Do we offer, I know a lot of the schools have, free meals for kids. Do we have anything that it doesn't exist
No,
below kindergarten? Yeah.
yeah, no, Head Start. So Head Start does provide meals because they're mandated to do that. And they have kitchen and all that stuff. We have tried to figure out a way to do that. And in the past, we really worked on trying to do that. The cost and the administration of it is really prohibitive. We have had some of our programs able to access the summer meals program in the summertime. And so some of our bigger programs, and especially during COVID, when it was a little bit more relaxed, because the regulations are the kids, I mean, we used to be able to go, our programs would go get the meals, like they would be across the parking lot in a different building in the case of in East Norwalk. And so they could bring the meals back into the center and the kids could have them. But that has become a little bit less as things have changed after COVID and gone back to the way they were before COVID. So, yeah, and just unfortunately, it would be great if we could do that, but the cost and the paperwork, and just for our smaller programs to be able to do something like that we're just not able to do that.
Thanks.
Yeah.
Yeah. Councilperson Weatherstrand.
Thank you. Mary, I also just wanted to express my gratitude for you being here. And I'm, just very moved by the presentation and your passion and your expertise. And I think just you're obviously a treasure for Norwalk, fulfilling a very important role. So just, I had a comment and a question. One thing I was thinking about as you were talking about the emphasis on reading, which is so important in early childhood, there's also a social emotional component to that. And I was just wondering if you could say a little bit more. There's the brain development and the sort of creating, preparing people for children to study, but there's also that really important social emotional piece, especially when you're promoting that in families. And I just wondered if you could say a little bit about that.
Yeah, I mean, that you are so right. I mean, that is so important. And so we really work a lot with the kids, and we can do a lot of that through books. I mean, to your point, books are just so rich in vocabulary and just illustrating empathy and different things but even through play. I mean, all of our programs are play-based, and that's we play all the time. That's how kids work, right? That's their work. But those connections that they make through play are so important, because that's how they learn to, eventually share and negotiate and rules, and just having that focus that they can play with, and then having an adult playing with them and not directing their play, but really playing along with them, and then kind of following the child's lead. That gives that child a lot of ownership and a lot of agency to kind of do their thing, really, and really be able to then have that adult kind of complement that and talk to them and really pay a lot of attention to them is so important. And then it forms that real close connection with that caregiver and the parent as well. And that's what kids need. I mean, they need that really secure attachment in order to be really fully developed social and emotionally. And our kids, you know, there's a lot going on in the world. And
Mhm.
so it's such an important thing for kids to have that and to really have that anchor. And that's what our programs, you know, really try and do, is be that anchor, because sometimes home might not be a great place. And so we really want our kids to have those really secure bonds and attachments to our caregivers. So supporting them is really, really important.
Yeah.
Yeah.
And it's so protective for children as they then develop in terms of, you know, really, really early prevention of other
Oh,
mental health
yeah.
issues and things that
Absolutely.
can happen.
Yeah.
And then I just had a question, because I was struck when you talked about families utilizing public transportation.
Mhm. Yeah.
And that is such an important aspect of families accessing, especially families that don't have resources.
Yeah.
So are there other things like that you can think of infrastructure wise that support families being able to access some of these services? I don't know, nothing, it's not coming to mind for me, but
Well, I mean, housing,
Mhm.
if you talk about
It's all
infrastructure,
connected. All these systems
it's
are
all,
connected.
yeah, it's all connected. I mean, we know we have families co-locating with other families in houses. I mean, and that brings a whole bunch more, you know, issues when you have a lot of people, maybe unrelated, in the same home. Maybe you have a family that's, you know, renting a room in someone's home. There, you know, the dynamics of that can be sometimes not so great. And so yeah, I mean, housing is certainly an issue for families. I mean, we hear it all the time, and it's really tough, affordable housing, but you all know that.
Thank you, Ms. Oster. I have to say, I know, and I've heard you publicly acknowledge Chief Daniels and the support he has given you as long as he has been here. But I met you 21 years ago when my oldest son, who's now 22, was ready to go into preschool. And I was a parent at a meeting asking a whole bunch of questions because that was my first child, and I did
Yeah.
not know what I was doing. And I have to say, Ms. Oster, you are a true definition of what a good public administrator looks like. The
Oh.
presentation that you gave us today, connecting the dots and showing how your department, which is small compared to other city departments, has so many longstanding partnerships, so many meaningful partnerships to do the work that you have to do. You are truly the little engine that could, because you keep pushing up that hill. And so
Thank
I
you.
just want to say hats off to you. A job well done. I'm not going to ask you how long you've been doing it, but I know I met you 20 years ago and you were doing it
Well,
then, but doing
13
it.
years here.
Well, there you go.
Yeah.
Doing
And
it well then, but doing it extraordinary
well, thank you.
now. And we're just so grateful to have you give this service to the young people as they begin their educational track. Does anybody else have anything for Miss Oster? Okay. If not, thank you again. We will not keep you for the rest of our
Thank you all.
agenda, but thank you so much.
Okay, thank you all.
You are
Bye-bye.
very welcome.
Thank you, Mary.
As we move down, we are now at number 5, our action item. A, Chief of Community Service. Authorize Mayor Harry W. Rayleigh to execute any and all necessary agreements, documents, instruments, or amendments to fund the multi-system coordination program in partnership with the Fairfield County Community Foundation and the amount of $200,000 from the American Rescue Plan Act, ARPA, administered by the Community Service Department. Funding source, ARPA account noted. Chief Daniels?
Yes, hi, good evening. And if I may take the liberty to just acknowledge Mary Oster's work as well and just put some context behind it. She is a one-person department. And you know, oftentimes we think of the resources of providing, but you know, especially as we enter the budget season, as you all will be deliberating, as you always do, that the value in having a person coordinate bringing folks together is often overlooked, and that it's so critical, especially now in terms of you have all these entities working, but bringing them together at the table so we can share vision, share resources, look at the data so we're not duplicating services. So we're clear on who's doing what over here. How can I transition this family to your service? And you know, that's all critical in the work that you know my department does every day. And Mary Oster does that so well. She is the glue to the early childhood work in you know Connecticut's sixth largest city, which is us, 91,000. I think the last census has said for our city, and we continue to grow, which I believe is a nice segue into this coordinating context. You all have received the company documents. I hope you had an opportunity to look through them. A couple of things, as you all know, since March 2021, cities and governments across the country has received American Rescue Plan Act funding. And as I reflected in preparing this and just thinking about, you know, since 2021, I mentioned this, I think when I was in person, that our department has shepherded almost $4 million in the city to nonprofits, to social service entities, to support the work that they do, because they truly are the safety net on the ground, whether it's early childhood, our seniors, COVID relief or housing assistance, mortgage assistance, educational assistance, social service assistance, food assistance. You know, I take pride in being the steward of those funds to support our most vulnerable, and particularly through the nonprofits, because they are the one that provide the direct service. And so what you have before you today is the last of our ARPA funding, which is the $200,000. After this, we're gonna have to go back to basics and figure out and work with our partners and our philanthropy. I also want to point out that this funding comes through Senator Duff, so I most certainly want to acknowledge Senator Bob Duff for this $200,000 that is before you. So I do, you know, to know me, I always like to have prepared marks, so just keeps me focused because I can keep talking. I'm sure we all want to go. So if you will allow me and indulge me, this initiative focuses on a specific group of young people, youth, who are at the center of a variety of multi-systems. As you have heard, since the summer, you know, Norwalk, we've had a shooting that went public. We've had a stabbing, and as we've learned, we know who these young people are. We know what's happening, but the struggle was these multi-systems and coordinating services of coming together to try to support them. Oftentimes, these young people are struggling in education. They're often justice involved, social services, mental health services, and often these are the young people that are falling through the cracks. These are young people who, for various reasons, face significant barriers. They're often exposed to or proximity to violent activities due to systemic challenges or lack of positive outlets. They're struggling, they're disengaged. They're often well known to the community and schools and urgently need targeted, laser-focused intervention. So this initiative is designed. I take pride as we put forth this last piece of funding that through our department, I think, you know, from a department perspective, that we see these youth. We believe in their potential, and we are also committed to providing the resources. So this is a one-time allocation. As noted in your package, we are partnering with the Fairfield County Community Foundation to help lead it. They're going to shape it. They're going to write the RFP. But again, the city, we will work in hand, but they would be the administrator of the entire process. As I pointed out, I want to thank Senator Bob Duff. But also at the foundation of this, that we hope for it to be sustainable effort, recognize this is a one-time investment on the city side, and that we are committed to thinking strategically about long-term funding, leveraging this initial investment, as we always do, to attract additional partners, including philanthropic organizations, federal and state programs, and local stakeholders. And then I'll close with this, that this particular initiative, it will meet about 30 to 40 youth in the city. I think it's noted in your package. We know who they are, but we haven't been able to coordinate and really support them and be flexible and be innovative and try a lot of new things to support these youth and their families. They're in our community, they're our neighbors, but the system hasn't been able to figure it out. So this support with the strategic thinking of the Fairfield County Community Foundation, they are our thought partners to help us really think creatively. And we often say the phrase out of the box, and really figuring out what can we do, what's working, what's not working, and hope to be, again, a model. We're working with the NPS, or the entire social service system, the juvenile system, DCF, because oftentimes these young people are involved in all these systems, but no one's bringing all the systems together to say, what are we doing? What's not working? Let's figure it out. So I'm always excited about these opportunities to, from a city perspective, to say we care about the youth of Norwalk, and we're showing that by making this initial investment, and just having Fairfield County Community Foundation as a partner, I think is the icing on the cake, and their commitment to support us. So with that said, I'll take any questions. Again, you have your packet before you, and through you, Madam Chair, I'll take any questions. Thank you so much again, as always.
Councilperson Wiggins.
Thank you, Madam Chair. Lamont, thank you. I really, I'm passionate about this work, and I know how dire it is, obviously dealing with some of these students that you speak of. So I'm really excited about this, and I know they do a great job, in orchestrating whatever they got to do to, help. Just one question: what exactly would they be doing?
So we'll be working with the Norwalk Public Schools, because at this point, we're looking around that 13, 14, 15. At most, the young people are in school. We are working with them to identify a definition of high need, what constitute a young person within the school system with our community that would warrant this type of intervention. But to your point, one of the biggest pieces, again, in my opinion, that is understated is you need resources to bring the resources to the table. For example, you all know I'm a licensed clinical social worker by profession, and having the school at the table in the same room, having the therapist at the table in that same room, having the Department of Children and Families in that same room, having juvenile justice, having the family, having the mentor, Mr. Wiggins, that just doesn't happen on the regular. So this intervention will cause all these entities that are involved in these youth lives to say, we have to come together and meet, that if we really want to see success, the organizations, the entities have to be talking together to figure out what is in the best interest of these students. And it's just not happening. Then there will be services that the young people, again, looking at what's happening, what's not, through this funding, they can add additional resources, but that all remains to be seen in terms of what need it would be by a case-by-case basis in terms of the family makeup, and then what that youngster needs. But what we're paying for is kind of, in a lot of ways, mandating that you all will have to come to work together, which just doesn't exist. And we hope to model and sustain that and make that become a way of intervening in our most high complex, challenging, really struggling youth and their families in our city that call Norwalk home.
Do you have an additional question, Councilperson Wiggins?
No, I'm sorry. I had the hand up. I'm gonna put the hand down. Thank you, Lamont.
Yes, thank you.
So me and the chief have spoke about this way before the summer, but really with the incidents that happened in the summer, I need to take a pause to explain to maybe even the community, anybody that's going to watch this. This is building a system, not a program.
That's right.
This is not about a program. This is not about a gathering of kids and giving them a direct service. This is not what we are committing to do tonight. What we are committing to do tonight is to pour the foundation to build a system of people who are coming, as the chief said, from different entities to talk to each other. Now, someone say that's simple, they should just do it. If they should have just do it, we should have been doing it. And clearly we haven't been doing it. So we have to build this system. When you are building systems, there's a level of accountability and there's checks and balances. And that's why it's important when we find youth that have maybe been touched by many programs, but we have not seen sustainable change, to make sure that the system part of it is working for the good of that young person. So that's why it's very beneficial to build a system, not a program. There's a distinct difference. We are trying to build systems and not a program. I also have to say to Chief Daniels, thank you for being transparent in your department to being able to assess what the need was. Because you as a chief can say, well, we're doing a job. We're doing it. But to be able to assess that the need is not just for another program, but the need is actually to build up our system. I want to acknowledge that at this time.
Thank you.
Councilperson Smith.
Gosh, I want to acknowledge our chair heirs for Nicole.
What she
You
said,
almost
I
had me in
mean,
tears. You almost had me in tears.
yeah, you said it eloquently,
this is-
better than me.
Really, Nikki, thank you for your leadership here and working with Lamont so closely, because you work with our kids, right? And you've got that public administration background, and you know what's needed. And I just want to commend you for that. And Lamont, I say it all the time, you are a treasure to this city. And your gift really is to bring those services together. You've done so much work, and I'm just from having my own experiences as a teacher, working with those kids who are they're just going down that path, right? And you're working so hard and, trying to get them what they need. And, you're working with your principal and your vice principal and your counselors, and it's just not working. And these are kids who are they're beautiful, right? They're beautiful in their hearts, but they have just, gone down a very difficult path. And, how do you get them back? And so, this is incredible what you've put together. How do we sustain it? $200,000, it's just the beginning, but that's another thing I know about you.
I'm working on that already.
I know, and you will
know
make
I
it
am.
happen.
You know I am.
Those partnerships is,
Yeah,
that's what we're going to have to depend on.
Yeah,
So this
absolutely.
is huge.
Thank
It's
you.
huge for our
Thank
kids.
you.
Thank you.
And I just want to just shout out again to Fairfield County Community Foundation. Maybe I'll invite them one day, but they really are a thought partner. I mean, this is what they do. They look at systems, they look at best practices, they have the resources to look at what's happening across the country. And they're also in Norwalk, I might add. And they have just been a partner with the city to just help us think about it. I mean, again, they're going to lead it, but of course, obviously, we will be I will be engaged in every step of the way, but also help us looking at the sustainability piece, to your point, Councilperson Smith, and look at how can we invest this. I mean, the data would have, I mean, the data will be there. And then I believe the data is going to be promising. And because the data is going to say we're making a difference, I believe the resources will be able to come thereafter to say this is something we should be doing ongoing. So thank you for that.
Any other comments or questions for the chief? Yes, Councilperson Dunn.
Hi. I think this is great. I think one of the pieces of it that I'm really excited to see is capacity, because I know, like Barbara says, but I'm still every day in this school, and I have those kids, and it's just getting them to school. My husband was last week, I came home, I got a kid to like engage day. It's only 1:45.
Yeah.
It's like, it takes a long time. Doug, too. You watched me, right? You saw me. But a lot of times it's like you want to refer kids to programs that like we're full. So I think it's really important that this might be the method to talk about what the capacity, whether things are full, what our needs are, and before we start throwing money at things, because we need to be fiscally responsible and make sure that there's
Sure.
good outcomes. I love that it may highlight the areas where we need to put more resources or, things that we need. I think it's great. Thanks.
Right, thank you. And again, I want to thank Senator Duff. I just want to bring us back to, I mean, there's a lot of moving parts to this, and maybe next year, I'm not going to hold myself to it this year, really share the whole kind of, I can't think of the word right now, but just want to highlight, with your support, we are in the process, if you recall, the mental health gap analysis that's happening right now. So that gap analysis will inform this process. This process will inform the mentorship program. So I'll remind myself next year, to your point, to connect the dots so you all can see, to your point, around how are taxpayers' money being spent, and then what is the return on investment. And let me be very clear, I am very aware that this is taxpayers' dollars, and I want to make sure I'm committed that the money I'm advocating for, it's to good use. But I think what I wrote down just brought back to me, I think Norwalk has a story to tell of how we are using these investments to make a difference in the lives of our residents. In this case, I'm talking about young people, and I'm really excited in the next couple of months to really begin to lay that down and share how we are making investments and how that is then the return on investment to our city. So I look forward to engaging that as the data starts coming in. And that's what Fairfield County Community Foundation is there for us, to help us articulate and tell our story. So much more to come. Thank you for that.
As I constantly tell everybody, particularly when we're in chambers, this department does a lot of Lego block work. We do a lot of foundational and building block work here. And as the chief says, this particular system connects to other work that is being done. So nothing is being done in a solo kind of manner. Even if we reference the presentation from Ms. Mary Oster, you can see how she's extending herself in partnership. We are a hard department to top, because my particular opinion, the community service department reaches the most residents because we are the ones that deal with the residents in need. They come to us because they need something. And so when you're in a service mentality, you have to be able to be a Lego builder and build blocks to make things connect so that it is sustainable. Okay. Any other questions? My time. Oh, my time is lovely.
Just another comment. Just want to draw your attention, especially to new council members. We have worked very hard to update the city's website, particularly the community services department. I have personally been moving stuff around. And if you look norwalkct.gov, and if you go to the left, you'll see ARPA funds at work. That's a document that will show you, out of the 3.7, where it was used, how it was used, and what the impact was. And we just closed the $500,000 again. You know, I talk to you all a lot, so sometimes it's a year later. I will be posting the housing assistance that we help with mortgages and rent for those folks that were impacted by COVID. And so we will be putting that report online. Again, it's federal dollars, it's taxpayers' dollars, it's public information. But again, for your pleasure, want to, and I think I sent an email to you all with that document maybe about a month ago, but we are now working, I'm taking personal engagement with the city's website. So I would encourage you all, and to the public, I know that came up in last public comment of, where the money goes. I have reports now that I'm actually uploading on our city's website, and it's open for the public to view, and encourage you all to review them as well. Thank you.
Okay. Anyone else? May I please? Well, thank you, Chief Daniels. Let me say
Thank you. My
Thank you,
pleasure,
Chief Daniels.
always.
May I please have a motion to adjourn? Thank you, Council.
But you gotta
We gotta
accept it
finish.
first.
Sorry.
Oh,
Ready to go.
look, you see how ready to go. All in favor, raise your hand.
Excuse
I
me,
appreciate
Madam
it. Thank you
Oh,
Chair.
very
wait,
much.
wait,
Excuse
Chair.
me, I'm sorry, Madam Chair.
Councilperson Greg has something to
Yeah.
say.
We need a motion first for this item before we vote.
You know
And
what?
I'll be
You are
happy to move, I'll be
absolutely
happy,
correct.
I'll be happy to make the motion to
Ah.
approve this authorization.
Thank you, because I would have to backtrack. So there's a motion to approve the action item that has already been read to your hearing. All in favor, please raise your hand. It is unanimous. Great. Now may I have a motion to adjourn? Councilperson Dunn, thank you. All in favor to adjourn? Wonderful. I see you, Mr. Sutton. Good night, all.
Thank
Have a
you
good
all,
night, y'all.
everyone. Have a happy
Ta-ta.
Thanksgiving too. Thank you again as
Same to you.
always.
All
Thank
right,
you
good
again as
night.
always.
Good
Thank
night.
you.